So good morning, everyone. I have to apologize. I'll decide in a minute if I need my glasses or not. I'm at, that middle age where it's back and forth, so we'll see. I hope everyone is doing well. Welcome to balmy Cleveland, Ohio. If you're not from here, you're experiencing lake effect snow. So hopefully that passes by the time you guys get on the road tomorrow. But as Suzanne mentioned, I've been with the office for about 7 years now. I'm also a patient. I consider myself quite lucky. I would say my disease course has been relatively mild, knock on wood. I do a lot of the behind-the-scenes work, and I am in the office part-time. So I know many of you, but some of you I have not met yet. I know Jackie's been on the phone with a lot of you, and I'm looking forward to meeting each and every one of you this weekend and spending some time with you and getting to know you. So thank you for being here. I want to tell you a little bit today about why we're here and how we got here. So as part of my role and all of us in the office, we are focused on advocacy a lot. So you might see us doing things like giving, lupus summits, and we might be out there holding walks and different events in the community and support groups. But behind the scenes, there's a lot of things that go on, advocacy being one of them, where we are doing a lot with the state of Ohio, the Ohio Department of Health, as well as working with our national office to make sure lupus is at the forefront of our legislators' agendas. So we want to make sure they know lupus. We want to make sure that they are aware that there is no cause and no cure at this time, so that we have to find a cause and a cure, and we make sure it's important to them. So just to give you a brief history, in 2016, the Lupus Foundation of America, Greater Ohio Chapter, partnered with Rama Consulting through funding from the Ohio Department of Health to complete the first ever Ohio Lupus Needs Assessment. The project was designed to identify, collect, and analyze data that provided insight into the personal and public burden of lupus patients in the state of Ohio. And basically what we wanted to know is how to coordinate care services for them and promote better health outcomes for those that were impacted and living with lupus, as well as their caregivers. We needed more information. We know that in the state of Ohio, there's estimated to be about 60,000 lupus patients. So with that in mind, we really needed to understand what we could do to serve the lupus community better and promote the agenda of lupus. So what were some of the things that we did for the Lupus Needs Assessment? We held over 35 consumer and caregiver focus groups. I know some of you in this room were involved in that process. We held a Lupus Action Planning Summit. We had consumer and provider surveys that we conducted. I think that really reached like thousands of people. There were 245 key informant interviews. We took a best practices inventory, reviewed 2,000 medical articles, and performed a massive amount of data retrieval and research. So what were some of the things that the Lupus Needs Assessment found? So some of the key findings of the assessment were the complexity of lupus makes it extremely difficult to diagnose and treat. I feel like I can look at you and say, right, preaching to the choir. Lupus subject matter experts are needed to promote lupus education curriculums to early responders. So some of the early responders, whether they be family medicine doctors, those working maybe nurse practitioners at community health clinics, people of that nature really needed a refresher and an overview on lupus. And that became very apparent to us during this process. Number 3, there's a lack of awareness in communities regarding lupus. And obviously we know that not many people really know lupus, and if they have heard of it, they don't understand what it is. And also existing data systems need to be coordinated to develop a better epidemiological profile of lupus. So it's basically looking into the idea of a coordinated database with lupus patients, sort of a registry, if you will. So as a result of the outcomes, 5 major recommendations were made, the things we needed to do in the state of Ohio to ensure that lupus patients were getting the appropriate care and support that they needed. Number 1, coordinate existing data systems to fully understand incidence, prevalence, associated health disparities, and develop a comprehensive epidemiological profile. That is something that the Lupus Foundation in and of itself Our office isn't as focused on because we do know in other areas of the country they're working on that, and we're hoping it reaches us at some point in time. Other recommendations were develop continuing education curriculums and target this education to a broader range of early responders and support services. 3, promote awareness of existing lupus educational and community resources for both patients and providers. 4, develop targeted outreach strategies to more effectively engage minority communities in lupus research and support services. Obviously, number 4 is important because we understand that there is a disproportionate amount of minorities affected from lupus. And number 5, develop patient navigators who can provide patient education and assistance while connecting with necessary support services. That is why we're here today. And this is where this meeting comes from, and this is where we began to understand that more support was needed in the community for lupus patients and their caregivers. So we continued on as time went on. We received further funding in partnership with Weimer Consulting and from the state of Ohio that allowed us to begin work on completion of lupus needs assessment recommendations. So, putting words into action. Between 2017 and 2018, Dr. Stan Ballou at Metro Health Hospital, RAMA, and ourselves met goals and objectives as set forth by the state of Ohio. We formed over 50 partnerships with state agencies. They were mostly healthcare agencies and community health offices. The outreach created needed awareness and education to the populations most at risk. Over 460 healthcare professionals received lupus education for healthcare professionals CME and CEU training. This prepared them to be on the outlook for lupus and to be better equipped to treat lupus patients. Over 400 lupus patients attended statewide lupus summits, providing them with access to much needed lupus patient education, support, and resources. Better disease navigation were transferred to the patient. So they really received a lot of information at those summits. And then finally, a lupus toolkit was distributed to over 5,000 healthcare providers across the state. It's cut off, but that's okay. We just updated, as part of our new agenda, we just updated the toolkit. Some of you might have seen an email that came out yesterday, but we're doing that this year as well. So we really just revived it and gave it a lot of energy, and you'll be able to take a look at that as well at a certain point in time. So in 2018 and 19, we took, in November 2018, we took a bus with over 50 advocates to the Ohio State House to advocate for lupus funding. You can see a group of us there. I see some familiar faces in the room that are also in this picture. So it was fun. I will say that during the course of the day, we did learn that a lot of our legislators have heard of lupus, but they have no idea what it is. And if they did know, it was very limited. So it became very apparent to us that our legislators need to know more about lupus. So in the coming months, from January 2019 to May 2019, our office made many trips to Columbus to meet with legislators and work on ensuring money was put into the Ohio budget for lupus funding. Many of our Ohio advocates were involved in this process through both advocacy messages as well as in-person meetings. I can say it was a lot of work. We had many, I think Suzanne, myself, Leslie, and Nikki. Where are you, Nikki? There she is. We had a lot of early mornings, a lot of 5 o'clock on the road trips to the State House, and a lot of testifying in front of senators and other legislators. So it was a very involved and intensive process, but our hard work paid off in July 2019. House Bill 166 was approved by Governor Mike DeWine, which included line item 440481, in my brain forever, which required money distributed to the LFA-GOC to operate a lupus awareness program and further lupus needs assessment recommendations. So basically that means that we have been given a line item by the state of Ohio to continue the needs of the recommendations of the lupus needs assessment, and that includes hiring, training patient navigators, and working with our facilitators to update them as well to make sure we are providing across the state of Ohio the best support services for lupus patients. So that was exciting. It was a very exciting summer for us, so to say. So where are we today? After months of planning and working with the Ohio Department of Health, we've developed a plan of action which includes 20 deliverables. that directly link to the lupus needs assessment. One of those deliverables is today, this weekend, and working and training. So our ultimate goal is to make sure lupus patients across Ohio have their needs met. Part of our deliverables, as I mentioned, include this training of patient navigators and our current facilitators across Ohio to assist with ensuring the deliverables are met. It's a tall task, but together we can do it. What can you do? Success in advocacy. So why were we successful? I think the biggest thing that I can say is we asked and the state of Ohio responded and you performed. People in this room performed. People we asked performed. So we encourage you all to keep your eyes and ears open for LFA GOC calls to action. So if you're reading your emails, newsletters, social media posts, and you get something that says, hey, listen, we've got an important thing going on. We want to make sure our legislators know about it. Maybe there's a bill being passed that we support or we don't support. We want to let them know. Be sure to make those phone calls, send letters, things like that. So we have a really nice system in the office called Salsa, and we can generate those letters for you, and all you have to do is hit a button. So it's a wonderful program, and we hope you use it in the future. Participate when you see LFA GOC and our national office calls to action, whether they be in-person advocacy efforts or emails to legislators. Ensure your local community is informed and aware of our advocacy efforts and encourage them to participate. And make sure patients and their caregivers are informed and encourage them to join in. It really does make a difference. The things that you're passionate about, if you can call and make sure the legislators are aware of them, it's extremely important. So we want to make sure that everybody here is doing that and willing to do that on behalf of lupus. So today we train and we prepare, and tomorrow we lead the way.